So how are you enjoying all this hot summer weather, those hot, steamy days and nights? You know, if you're one of the many people who suffer from COPD, you might not be enjoying all this hot weather. But stay tuned because our guest today is going to give us some tips on how you can still be outside, enjoy the weather, and feel better. Stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. Hey, Mary Beth, how are you this morning?
Good morning, Andrea. How are you doing today?
I'm doing well, thank you. On these hot, steamy days, as I was mentioning.
We're happy to have with us Tony Colon from Coral Harbor. He's been with us before, so good morning, Tony.
Good morning.
Good morning, Tony. And a big shout out to Coral Harbor for being such a great supporter of SCAN. Thank you, guys.
Thank you, Coral Harbor.
Salute.
So tell us, Tony, a little bit about what you do for Coral Harbor.
Sure. So I'm Tony Colon. I'm a nurse. I've been a nurse for 25 years. I started out actually in acute care rehab. I worked in a couple little hospitals. And then when I moved down to Ocean County 25 years ago, I got into subacute and long-term care. So the company that I worked for then, we specialized in cardiac, pulmonary, and wound care. I'm a wound care nurse by trade. So now I work for Coral Harbor, and I'm their external nurse and marketing person. So I go to the hospital, I see patients at the bedside, need be, and I help them transition over to subacute or long-term care.
Okay, very good.
That's great.
So we're talking about this hot weather, and when you have respiratory issues, hot weather can affect you as much as the cold weather. We'll talk about the cold weather another time, but right now it's the hot weather.
Yes.
So first, would you explain for our listeners, Tony, what is COPD?
Sure. So COPD is a chronic obstructive pulmonary disease. It's a general term for a bunch of different pulmonary diseases, such as emphysema, chronic bronchitis, asthma, those kind of diseases that are recurrent, that people get lung infections constantly. They're usually classified as COPD. Generally, it involves some kind of swelling in the lung, either in the alveoli, the bronchial tubes, or the airway itself. As it gets irritated, it gets swollen, and people find it hard to breathe. There's lots of symptoms. People can cough, they can produce a lot of mucus, they get short of breath, tired. Those are the general symptoms that you would see with someone with COPD.
Not good.
No. And then as we're entering this warmer weather season, how does that come into play with people with those conditions?
Sure. So in the summer months, it's hot, and it makes it more difficult for people with COPD. The body's natural state is to keep homeostasis, keep normal temperature, have everything going normally. So your body is constantly trying to keep everything within balance. When it's summertime, it's hot. It puts a lot of stress on the body, it puts a lot of stress on the lungs. So somebody with COPD, that hot air, breathing in the hot air is going to irritate their airways, and it could trigger, some kind of inflammation, causing shortness of breath. They might be fatigued a lot faster outside in the heat. So it's very important for people with COPD to learn to manage those symptoms during the hot months. Typically, what they need to do is plan out their day. Like if people with chronic COPD, they are dealing with this issue, it doesn't go away. They have it for a lifetime. So they're on treatment plans with their doctor, and they need to build out their day. So they want to go outside when it's cooler out in the morning and in the evening time, and really try to avoid being out during the peak heat time. A lot of times they can going in and out from like extreme temperatures that will also exacerbate their COPD.
Like if you were in a car and the air conditioning was on full blast, and then you go outside for a while, that's a big difference in the temperature.
Absolutely.
Right?
Yeah, especially they're going from really being really cool to being really hot, or vice versa. And some people that can trigger an exacerbation there. Somebody with like chronic asthma, the asthma will flare up. If they have like bronchitis or whatnot, that'll exacerbate the the symptoms. They'll start coughing more and be more short of breath.
So, in speaking about symptoms, what are some of the things that we might want to look for if we haven't been diagnosed with a COPD?
Sure. So there's millions of people in the U.S. now that have COPD and probably don't know it.
Don't even know it.
You know, COPD is classified by chronic condition. So that means that somebody is getting sick over and over again. They could develop like bronchitis or have some kind of upper respiratory symptoms. And if they are getting these kind of infections periodically throughout the year, that would probably be the first indication that, hey, you know, there's something going on. Along with that, you know, they would feel tired. They would feel more fatigued. They would feel short of breath doing certain things. You know, if you have stairs in your home and you used to be able to do it fine, and now you're finding you're short of breath when you get to the top of the steps. You know, some people might say, hey, I'm getting old. Maybe I gained a couple pounds, but that could be a symptom of COPD. So you would want to go consult with your doctor and talk to him and let him know, hey, you know, I've been sick a couple times. This is what's going on. You know, keep a record, write stuff down so you don't forget. And your doctor will be able to run some tests to help diagnose whether or not you have COPD.
So the symptoms are so generalized that it could be almost anything. And I could see where people would have a tendency to just sort of, you know, it's nothing.
Yeah,
but
absolutely.
Yeah, you definitely have to see your doctor. This is not something you're going to self-diagnose.
No, absolutely not. In the beginning, it's more general. You know, they don't realize it, but as time progresses, COPD gets worse. You know, it doesn't ever go away. So they'll start coughing. They'll start producing mucus. They'll start really struggling, you know, to breathe normally. And if they're not on any treatment regimen, they'll find life to be very difficult. You know, oftentimes when you get sick with an upper respiratory, doctor is going to give you antibiotics, and maybe they'll give you some inhalers or something like that, something short term. But if that person is continually getting these upper respiratories and being short of breath, they might need to be diagnosed and might be need to put on long-term medications. So doctors, there's lots of medications out there. Some are inhalers, some are pills, some are mini nebulizers, depending on where the person is. And the doctor would, you know, put them on a treatment plan.
Now, I'm thinking that there's, like so many chronic conditions, there's probably some lifestyle changes that you could make that might improve, or not just improve, but maybe so that you never get it. And what might some of those things be?
Absolutely. So the first number one thing is do not smoke. If you're a smoker, I strongly suggest you quit. Smoking cigarettes or the vape pens are just as bad. Vape pens are 10 times worse than cigarettes. Cigarettes take anywhere to a whole lifetime to start showing any kind of symptoms later on of respiratory disease. The vape pens will do it within 10 years. They'll have popcorn lung and really, really struggle to breathe. It just
can I just say what's really upsetting about the vape pen is that so many young people are using that.
Absolutely. It's
and so,
very popular
of course,
now.
When you're a kid, up here, you're invincible. Yes. So 10, 15, 20 years from now, you can really be in bad straits.
Yeah. And I mean, with the younger population now, we're seeing some of the kids are coming in after a couple of years of using the pens, and they already wrecked their lungs. So if anybody using those vape pens, just stop using them. It's not worth it. The next thing that I would suggest people, you know, because sometimes it's not even from smoking, it's work-related incidents where someone will develop lung disease. You know, the first thing that comes to mind is people in the construction trade. You know, you're doing fiberglass or plaster or something like that. They're sanding stuff. There's particulate dust, and you inhale that, and that will damage your lungs over time. It's very important to use proper respirators. You know, there's special masks. Younger guys, they don't like to use that stuff because it looks silly, but
they're invincible.
Yeah, it's going to protect your lungs. You only get 2, and you need it for your whole life. So, you know, you got to protect what you got. You got to take care of it. We got to be good stewards. So it's important to get that knowledge base, you know, spend a few dollars and get a good mask to protect yourself, especially those working with any kind of chemicals or dust. those two things, you really want to make sure you protect yourself and use some kind of respirator or special breathing apparatus for that specific job.
Now, for people that have COPD, and it's, of course, it's hot, and we know we have to be a little careful, manage your day, et cetera. And I'm thinking on a really hot, steamy day, you're probably better off inside with the air conditioning. But on days when you need to venture out, what might be some of the precautions that those folks should adhere to?
Sure. So, firstly, I'm going to say that most people with COPD, they're on some kind of a treatment plan. And, naturally, when you start feeling well, you start to think, hey, I don't need this stuff anymore. But it's very important to stay on your treatment plan. If the doctor gives you medicine to take every day, take it every day or as scheduled. I would definitely take it in the summertime because you don't want to have some kind of exacerbation and all of a sudden you can't breathe and you're going to the hospital because, 911's coming to pick you up. But when it's really hot outside, if you have to get outside, try to cool down your car ahead of time. Drink lots of fluids, make sure you stay hydrated. And try not to overwork yourself outside. If there's anything you can do later, I would plan it for later in the evening or earlier in the morning. Yeah. You got to really change your life around a little bit with COPD, and try to exercise. Some people, depending on what stage they are in COPD, exercise will do a great deal of benefit you a great deal. So if you're early on in the COPD, just working out every day will help build up your lungs. And, you might not have as severe symptoms. When the older you get, the worse your COPD gets, you might not be able to do that exercise. So it's better you do it in the beginning, so as soon as they diagnose you with it, or, it's better to start exercising and do what you can now, better than waiting till the end and you can't do it.
And exercise could be as simple as just going out for a walk.
Yeah, absolutely.
Just keep moving, right?
Yep, just exercise. Yep. Exercise is the best thing. It's better than running in most cases. You can walk a little bit quicker, get that heart rate pumping a little bit, and you're doing what you're supposed to do. That's considered exercise.
Now, we need to give a shout out to Coral Harbor because you've got a special program there that is unique for folks who are suffering with any kind of pulmonary disorder. So Tony, maybe you can share that info.
Sure, absolutely. So as I was saying before, people that are being diagnosed with COPD, they see their doctor, and oftentimes a doctor who tries not to specialize in anything, he's going to treat a lot of things. So they like to send you to a specialist. So they'll send you to a pulmonologist who specializes in the lungs. So Shore Pulmonary, which is a big pulmonary group in Ocean and Monmouth County, they come to us at Coral Harbor. We work very closely with Jersey Shore Hospital. Shore Pulmonary goes to Jersey Shore Hospital and they come to us. So, in the event of any kind of illnesses or accidents or anything like that, someone's in the hospital, it's best to do your homework ahead of time and know where you're going to go before a crisis happens. Because once you're in crisis mode, you're not thinking where you're going to go. And they're going to discharge you from the hospital and you have no idea. You didn't check any of these places out and you don't want to pick the wrong place. You want to go somewhere where that's going to treat what you need to be treated. We have a pulmonary program on board on our site. They come and they round. We also have a respiratory therapist and piped in oxygen, which is another thing a lot of centers don't have. Usually they do like air compressors or something like that. We actually have piped in oxygen just like in the hospital.
So once again, it's a question of being prepared, and we hope no one needs those services. Exactly. But if you do, or a loved one does, it's good to know, exactly where to go, and that we have such a facility in in Neptune, right? You guys are Coral Harbor,
in Neptune. Yep. Right across the street from Jersey Shore. Like I say, it's just like life insurance. Or car insurance. You don't want to use it. You don't need to use it, but it's good to have. So it's good to do your homework. In this case, it's good to do your homework ahead of time so you know where to go if something happens, or if you have a loved one or a friend or something, you already know you have a plan ahead of time.
Absolutely.
Well, Tony, thank you so much for sharing so much good information. And I hope if you're listening out there and if you have COPD or someone who does, you take this to heart and stay cool and comfortable, but don't be afraid to get out. Just be careful and probably wear a mask, right?
Oh yeah.
Yeah,
Yep.
I would
Yeah.
think that would be another good reason to wear your mask. Yeah,
Absolutely.
regardless. Yeah.
Yeah, now that everybody's used to wearing masks, it's a good idea if you're in close situations with a lot of people and you have COPD. It's
Yeah,
a good idea to wear a mask because a lot of the medications, they reduce your ability to fight infections. So wearing a mask is a good thing for them.
very important.
Yes.
All right. Well, thank you so much for being our guest today.
You're welcome. Thank you for having me on.
Our pleasure. And remember, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone.
Bye. Have a great day,
Bye.
everyone.
Have a great one.